Good evening, Malden. I'm Gary Christenson, Mayor of Malden, and we are back at where else but Malden Access Television for a COVID-19 update. The day we hoped would never come has, and so we're going to spend this evening talking about what this red designation means from the state. The one thing that has not changed, whether it's green, yellow, red, white, we must continue to work together to find our way through this. There's just no other means to do it. We must work together. And so I, along with all of our panelists tonight, are going to repeatedly say, wear a mask, maintain social distancing, avoid large gatherings, etc. So without further ado, let me introduce our panelists this evening, and some of them need no introduction. We have Chris Webb, our health director, that is here with us. We also have Kourtney Nickerson from our Board of Health, who just finished up the meeting, and we'll be talking about our advice and guidance around Halloween. We also have Christian Lanphere, who's also been a past guest from Cambridge Health Alliance. And new to the show, we have Adam Weldai, who represents us on the school committee from Ward 5, is a assistant principal himself, and has participated in a lot of the discussions about what is going to happen with school moving forward. Again, I want to thank Ron Cochran, our communications director, who has organized tonight's event with, again, who else but our community partner, Malden Access Television, otherwise known as UMA. So without further ado, as we always at this juncture of the show, we're going to have some introductions from our panelists, very brief, because we know there's a lot of questions based on the new state designation that was given last night at around 6 p.m. So why don't we do that now? So first up, let's have Chris Webb say hello. And if you all could, as we make our way through the panelists, just provide a phone number and or an email address that people can contact you if they have a question that they didn't think during the show. So Mr. Webb.
Thank you, Mr. Mayor. We've had a change of events. We were doing very, very well with staying in yellow and going up and down in that range. And recently we've gone red, which isn't the optimal goal that we had, but it's not surprising. I think a lot of our conversations have been, when will the second wave come? And I think we were consistent with October. And so here we are, and that's what we're looking at. There are any number of reasons, and I'm sure people will ask questions, and I can give you we have only had 24 hours with the information. So we have an initial theory. It's not etched in stone yet. And if anybody wants to reach me, I can be reached at cwebb at cityofmalden.org, or call me in the office at 781-397-7049.
Thank you. Let's go to Ms. Nickerson.
Good evening, Malden. Thanks for having me back. I'm sorry to be back because it means that we're still ongoing with the pandemic. I want to encourage you all to keep up the hard work that you've been doing, wearing your masks, washing your hands, social distancing. Like Chris said, we have some challenging numbers to deal with right now, and understanding what that means for us moving forward. But keep using the tools that you have to keep yourself and your family and your loved ones safe, and by proxy, your community. It's hard work, I know it, but we can do it together. We will do it together.
Okay, thank you. Mr. Lanphere.
Thank you, Mr. Mayor, and welcome to my fellow panelists here. And good evening, residents of Malden. So my name is Christian Lanphere. I'm the hospital administrator up at the Everett Hospital, and I oversee the corporate emergency management program for the entire Cambridge Health Alliance system. We have seen a slight uptick in hospitalizations within our system. I think it was reported tonight that there's been also an increase in both ICU and medical beds in the hospitals across the state. It's a small increase. It's not a great increase, but it's a small increase. But more importantly, we are concerned that we're also seeing a lot of younger people coming into our emergency department to be evaluated, along with having some type of conversation with their primary care doctor within our system. So I'm here tonight. I'm hopefully here to answer any questions anyone has. I can be reached at 617-381-7153, and that's the hospital's phone number up there. Thank you.
Very good. Thank you. And finally, Mr. Weldai.
Hi, thank you. My name is Adam Weldai. I'm a member of the Malden School Committee, proudly representing Ward 5 and working with a dedicated group of members, including our chair, Mayor Christenson. And I'm an educator myself in our neighboring city of Chelsea. Glad to be here to talk about the role our committees played in navigating education in a pandemic, connecting to the community, and the phased reopening of our public schools. So all the contact information for the school committee members is publicly listed on the city website. But if you need me, you can reach me at Weldai, WELDAI, at maldenps.org. And I'm happy to be here.
Great, thank you.
Thank you.
So again, this might be a moment where I would ask each of you different questions, but I know there's a lot out in our city. So let's get right to them, Mr. Cochran. I know you have some lined up, so let's see if we can answer them as quickly as we can and take some live calls.
Sure, Mr. Mayor, but we always like to start off by reminding folks how they are able to access us. So right now we are live on Malden Access Television, which is brought to you Comcast Channel 22 and Verizon Channel 26. We are also live on the YouTube channel for Malden Access Television. And we are monitoring different platforms for your questions. The first and foremost would be our Facebook page. So we're actively looking for folks to reach out to us there and ask our questions to relate to the panel. We also are taking in-studio calls, which hopefully MATV can put up that phone number because my brain never remembers what that phone number is. You would think I remember it by now. So you can reach us in studio if you're comfortable calling. And then, of course, out there on YouTube, we'll look for your comments as well. But with all that said, normally we're out there looking for these comments. Because we did move into the red, we posted something on our Facebook page yesterday announcing as such. And it did spark quite a bit of comment threads that are going on in our Facebook page. So I'd like to actually first start pulling from that because there was a spirited debate. There was good questions. There was some panic. There was, some people that were upset. So I figured it would be a good place for us to start. So first and foremost, I'm going to summarize a lot of these because there were similar ones. There was some concern from a lot of residents about Malden Public Schools in their recent announcement to return to in-person learning for some of our students, of course. And that was slated to be this coming week after Columbus Day. Well, the question is, if we are diving into the red, how do we justify continuing with that plan?
All right, let's go to Mr. Weldai first, and then we'll jump to the rest of the panelists. So, Mr. Weldai, what are your thoughts on that question?
Absolutely. And I think it's a very valid question to ask. And I think that there should be a little bit of context put to that. So, we are in the process now, and we've been working slowly and methodically over the past couple of weeks of bringing back some of our highest needs learners. So for starters, we're talking about 200 students. So it represents about 3% of the entire student population of the Malden Public Schools. So out of the 6,650 kids, we're talking about 200 kids. On top of that, it's something that we have been really thoughtfully planning over the past few weeks, including the PPE being ordered, the necessary precautions taking place. We've been working collaboratively with both the Board of Health, with our teachers union, with our school department to make sure that things are ready to go. And the school committee took a step further last week and actually reaffirmed the fact that all the remaining educators, the folks who don't work with students with the highest needs, can actually stay remote and teach from their home if they choose to, which a lot of our folks are choosing to and doing a phenomenal job at that. So we've cleared a little bit more airspace, so to say, in the buildings for this to happen thoughtfully. The other piece that's just really important for folks to know is when you hear the phrase opening schools, this is not parents just popping off their kids Tuesday morning and see you later, we're out the door. The school department, particularly our special ed department, has been meeting individually with the families of the students who are coming back and the students themselves to talk about school's going to look a little different right? You're going to see teachers wearing different PPE. You're going to be wearing PPE. Procedures that are different are going to be in place. And those conversations are ongoing. So I know it's hard to sort of think about and to capture that way, but I think the key message is this is not just a reopening of schools. This is a very specific, small, and well thought out plan for, I think, a small and needed population.
Okay, Mr. Weldai, it should also be noted too that this will be spread out amongst all of our schools. So we're not having all 200 come back to one school or two schools, right?
Exactly.
And the other thing you and I spoke about during the week is that we did look into whether other cities and towns who have received the red designation have continued teaching this cohort, and they are, correct?
They are, and we've seen some like districts as well. And I know folks don't necessarily like to use Boston as a comparison, but Boston is a pretty good and a very relevant one. But the one that stands out the most, because we've been looking at Linfield, Middleton, Peabody, there were a couple different folks, but Haverhill, and we're in a unique position that our new assistant superintendent of special education just came to us from Haverhill, and she's the one who's been really leading the charge here. So she comes with some pretty time sensitive and relevant information that's been helpful, because Haverhill has actually got not just their high needs special ed students, but a lot of general education students in for a hybrid model as well. So we've really been able to work with her to make sure we're able to do this the right way, safely.
Okay, Chris, Mr. Webb, right decision, wrong decision? You're on mute, Chris.
It's the right decision. We have time per the guidance that's recently changed that gives us 3 weeks in red to gauge how severe the increases are. We've had a couple of meetings today, and I'm telling everybody, if we go from 10 to 25, we'll meet and we'll discuss it, but that's not likely to happen. I'm pretty comfortable saying it won't happen. We'll see a couple of upticks over the next 2 to 3 weeks. If it gets out of control, if there is a surge, we will, the right authorities will sit and we'll make different decisions. But right now, where we're at, especially with the population that's going into school and the size and the ability of the school buildings to handle hundreds of people, and there'll be 30, 40 people in a building, I think you're going to see that it's a safe, comfortable place for everybody to work. And for these kids that, need their therapies and education, get it. And if it'd be a sin, if we have to roll it back in 3 weeks, but if that's what has to happen, that's what we'll do.
All right, Ms. Nickerson, do you want to add to that?
Just that this isn't a rash decision. This was extremely well thought out, and I know that it's scary. I think for parents, for teachers, there's so much unknown. We've never been through this before, so I think that a lot of nervousness is coming from that, and not knowing what to expect, and not knowing really what might come. So I think we're all in the same boat here. We do have to trust that the people that need to are watching the numbers. We're keeping track of it. They've got a lot of really solid plans in place to respond if things do go awry. And we are focused on making sure that everything is as safe as we know how to make it at this time. So a little bit of an acknowledgement there that your feelings are valid. The nervousness is definitely valid, and it's shared, but we're all in this together. We're working through this, and we're navigating this to the best that we know with the tools that we have.
Okay, thank you. And Mr. Lanphere.
I'm going to take the advice of my colleagues here on the call. I'm a healthcare guy. I'd rather not weigh in on this topic.
Right. Okay.
The
And
expert.
we did check with the Executive Office of Health and Human Services today at the state level, seeing that this is the first time we've ever received that designation, to see if it impacted what was coming up next week, and they said it did not. I think what they look for is trends. If you were consistently at this designation for several weeks, then we might want to revisit. But for now, they think we're in pretty good standing to be able to continue forward. And I know while we're on the topic, Chris and Kourtney, and maybe Christian can add in, despite the designation, not all was bad, right? I think one thing you highlighted to me last night, Chris, was that the positivity rate remains very low. Can you explain that, the dichotomy between the positivity rate and the average per day?
Well, the average per day is a different measurement. So
Right.
it's how many people in the last 7 days per 100,000 people. So and we don't have 100,000 people. So it's a dramatic change in the formula, but it will work for any set of numbers you put in it. The 1.86 positivity rate is up a little bit from our previous one, which was 1.29. So we think that that's a 14-day count. So it takes over a bigger number than the 10 figures. So I don't know that I'm being clear, but it's a 14-day count of all the positive cases based on the 100,000. And the other one is a 7-day number.
Okay. Kourtney, what's the difference between the two measurements? A lot of people ask the question, what is the difference between their per average daily caseload versus the positivity rate?
Chris did a really good job of explaining this, I think, on our last session. So I'm going to kick it back to him just because I don't want to butcher the definition.
I was just going to ask Mr. Cochran to replay that because it was well stated on our last show. Chris, what's the difference for someone watching at home between those two measurements? Yes, Chris Webb, you're on mute.
I'm sorry, my mute bar froze. The difference is one's a count of people and the other is the count of the actual test. I'm trying to find an easy way to describe it. Again, the positivity rate is over a 14-day period. So they're totally separate numbers. One has nothing to do with the other.
Okay.
So they're counting how many people in the people tested for those 14 days. For the last 14 days, we had 5,762 people be tested. The total positive out of that is 107. That brings you up to a positivity rate of 1.86.
Okay. Which is close, Chris, to the statewide level, right? They're at around 1%. The statewide level positivity rate.
I'm sorry, you're breaking up. I'm sorry.
The statewide positivity rate has been roughly around 1%.
Yes, roughly. Yes.
Okay. Okay. All right, Christian, do you want to add to that? I know a lot of people ask the difference between those two.
I would just say that, in our catchment area, all of our communities and your neighboring communities have been in the red since the beginning of the pandemic. And we have not let up on our policies and procedures around this. And we're continuing to remain very vigilant that we know that this is not going away yet. And our hope is that we can continue to contain it before it gets out of control.
All right, Mr. Cochran, let's take another question.
I think we're going to stay on that subject of schools since we're talking about it. And that is, there's a question about the Mystic Valley Regional Charter School, being that they've gone with a little bit more aggressive model of more in-person learning than the Malden Public Schools plan. And the question is whether or not, I guess we'll ask that same question, but are there any concerns for Mr. Webb about their ability to continue that model safely with now this uptick into the red zone?
All right, we'll go to Mr. Webb, Ms. Nickerson, and Mr. Lanphere. And when we're talking, Mr. Webb, let's talk about not just them, but Malden Catholic. I believe the Chevrolet School's in, right?
Yes.
At least in the hybrid model. So let's talk about, generally speaking, does this designation impact those other systems?
Yeah, I've worked with both schools over the last 2 weeks on different matters, and I think their plans are they're definitely within the guidelines, and it's a choice they chose to make because there's the high school kids in particular need the education to graduate and to have chance of getting onto another school, and they also believe that acclimating kids to school is in this environment is something they can overcome. And we've got no complaints out of either school about what goes on in classroom. So that's a good thing. But this number is not enough to change the educational patterns of those schools. It's a minor uptick. It is red, but it's at the lower end of red. Remember, 8 or more, which is 9 really, will get you into the red category. So we're at the very low end of the scale. They know about this information as well. And if it gets out of hand and exceeds quickly, if next week we're up a few more numbers, we're going to ask the Chever School and Malden Catholic and Mystic Valley Charter School to at least Zoom with us so we can discuss what the trend is and then what they plan to do for the next week, because that'll be 3 weeks at that point, what they plan to do the third week if we have any arise again. A concern, a level that concerns us, puts us into a higher level of the red category. We'd have to have that discussion about options. Will they go remote? Will they cut down some classes? Can they change the cohorts so there aren't as many in a building in a given day? Things like that.
Okay, Ms. Nickerson?
I think I just agree with what Chris said. We need to continue to watch the numbers and be dynamic and ready to respond if and when it's necessary. And I think it's important to remember that kids learn really well in person in school, and we've been doing it that way for a long time. Zoom teaching is new to all of us, and it's a hard model to adapt to. We're not used to it. Kids aren't used to it. So we're all going through this together, and really, we just need to remember that we're a community, and without trying to be, Susie Sunshine the whole time, we are doing the best that we can as a group, trying to keep the kids and the family and community safe.
Okay, very good. And Mr. Lanphere, I would say another factor in all of this is just the difference in size of the districts. I mean, we're at roughly 6,500 students, and I forget what the numbers are at the other schools, but they're not 6,500. So, I have to assume that's also a factor to look at when you're determining whether or not going to red, means something to those other districts. Would you agree?
I agree with that. And I appreciate the fluidity of the situation, but also how different officials are adapting and
Right.
watching trends and making decisions based on science and based on what we think is the most prudent and safest thing to do for the kids. It's a balance.
Right. Okay, Mr. Weldai, you want to add in at all?
I think it's just important to remember that this is not an ideal situation for any of us, right? So, empathy and understanding has never been more important than it is now. And we are happy that I think there are schools in our city that have been able to pull this off. I think the one thing that we've tried very hard as a district to avoid doing, and we're trying to get our parents to avoid doing, is, comparing us to blank. Because no matter what that blank is, we are not that district. We're not Medford, we're not Melrose, we're not Mystic Valley, we're not Malden Catholic. Everyone's got their unique challenges, and we are working within the confines of our unique challenges. And so we know that this is not an ideal situation, but hopefully what's been able to start in the other schools in our city are able to continue, and it works out for them, and that we will get there soon too.
All right, very good. All right, Mr. Cochran, what's next?
Sure. So again, it's going to be sort of another one of those summary style questions. And that is one of the first observations that I had when I was looking at folks reacting to this announcement was, where are these coming from? Are these clusters? Where are the spikes coming from? Or can it be traced back to specific people, zones, or the places to avoid? Which is interesting, because this is sort of the same question that we've been getting since literally day one of this pandemic. So do we have a different perspective on that now?
Yeah, it was our first question last night. I mean, our chief of staff and I, when we called Mr. Webb, first question was, is this a result of a cluster? So, Mr. Webb?
The answer to that is no. We are fortunate enough not to have had any clusters. We had some residents involved in an out-of-state cluster, but they were older and they won't fall into they fall into the age group. They're in the 20 to 50 age group, but we've only had these numbers for 24 hours, and we have been watching their progression. What we think as of today, right now, is that we're seeing college kids either coming home or that have moved to the area who are getting tested to go to school. That's some of it. That's not by far, it's the smallest part of it. The next part is those parents who are now returning to work. And what I like to tell everybody is I have these different measurement sticks I use, and one of them is the morning traffic pattern. For months, the roads were green every morning, the most boring television you'll ever watch. There's nothing to tell you, the trains are running on time and everything. But as we saw the tick up go, every morning you saw backups on the choke points. So we know more people are going back to work in the last 3 weeks than they were previous to that. So we think that's got something to do with it. It's people living their lives and sometimes being a little too cavalier about how they go about it. Not focusing on their mask wear, not washing their hands. That's probably worse sometimes, depending on your environment, than not wearing a mask. You're just leaving your germs behind you on the way, and people have really got to focus on that. I know I keep a bottle of hand sanitizer on my desk, and if my hands go near my face, I sanitize just because it's good practice. It's a good habit to get into.
Okay, Mr. Weldai, why don't we at this point relay Ms. Ecker's
I was going to ask
we
you.
met with the families earlier on before this call. Why don't you take it away?
Well, I think, knowing that it's not a particular cluster, right? We know that there's a lot of individual decisions being made. None of us happened to be invited to the Rose Garden ceremony a couple of weeks ago, so we didn't bring it back with us. But we do know that there are a lot of individuals in different places who maybe aren't being as vigilant as they used to be. And one of the things that we're seeing, I know Ms. Ecker brought it to us. I've seen it at the Salemwood School. I know Ms. Jen Spadafora has seen it at the BB School. Ms. Luong has seen it in, the park on Harvard Ave, Miller Park. There are clusters of kids, teenagers, and sometimes parents with their kids and teenagers who are playing at the parks, which is great. None of them are masked. There are groups of people who are gathering together, even small groups, none of them are masked. And I think we're hoping two things. One, folks will really recommit to taking that personal responsibility seriously. But two, especially as we enter Tuesday the 13th, and we have some of our highest need students entering the Malden Public Schools, many of which are medically fragile, many of which are really taking necessary precautions themselves. Please, 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 if you are in a school building, if you are around a school building, if you are at a park that happens to be adjoining a school building, wear your mask. Even if you're as a family unit, even if you're a person who just happens to be running around, just please put on your mask and be really cognizant of the fact that we really need to look out for those of us who need us to look out for them the most.
All right, very good. Ron, what do you have next?
Sure. We actually have our first caller of the evening. Kevin is on the line. Kevin, go ahead. You are on the air with the panel.
Hi, Kevin.
Good evening. Hi, how are you guys doing? Good evening, everyone. Once again, thanks for hosting these meetings. They're informative, and information beats imagination, I believe, because what I perceive it to be versus what it's known to be, knowledge is power. So with that being said, for the longest, we've tried self-policing, relying on the community to be vigilant. Just so happens, I happen to have a Facebook page that is full of people from Malden. And you see people that's away 1 week, and they come back home, and a few days later, I see them out and about. Now, you just went to another state. You just went to Florida, for example, whatever. And here it is, not even 3 or 4 days after your return, I see you out in the neighborhood. Things like this, just driving around town, observing people wearing their mask as beard or chin covers, or not having any at all. At what point are we going to say, okay, this do-it-yourself thing isn't working? We have to come up with a way to enforce it before it becomes, a pattern of red Malden versus green Malden.
Okay, good question. Let's start with Mr. Webb. Do you see that with people vacationing? What's been your experience with all that?
Well, that's a valid concern. We don't get the notification of people who have traveled. If people go on the travel website and they log in, and they can get a detailed list of how they should perform. And then when they get back, they'll get notified. If they put their dates in, it will notify you when your last day of quarantine is. So there's no guesswork to it. But we have not had a lot of traffic on that as far as Malden residents traveling and using that site. So they're supposed to. You're supposed to register as you go out of state, but we're not getting a lot of traffic there. I know people are doing it, and that is a major concern. I mean, you may have got on the plane coming out of Florida without an infection, but by the time you land, you probably have one if there's at least one positive person on that plane. So travel, we're going back into historically smaller office space with fewer people, but still with an infectious disease. I think that's kind of ticking things up, and students going back and forth again, travel from school to home. We have been looking really hard at the numbers there, because if a student at UMass goes to UMass, gets tested, and he puts his home address, when he's processed and becomes positive, that report comes to us. And then we look at that and we realize, well, he's still living in Amherst. We have to send that back to Amherst so the count is correct. There's a lot of work. So that's what the part of the contact tracing does too. So we are straightening out a few cases like that every day.
Okay. Kourtney and then Christian. Kourtney, we have a hard enough time enforcing people wearing masks. Do you see us having the capacity, or ever having the capacity, to track where people are coming and going outside of the city? What have you heard and seen?
I think we discussed this at a Board of Health meeting a couple weeks ago or months ago, where we wanted to see what we could do about promoting the community wearing more masks. And ultimately, we don't have the resources. We don't have the police force to be out, policing people to wear masks, unfortunately. So we do rely on community and personal responsibility to step up and own your airspace, right? You want to protect those around you, make sure that you aren't being a spreader or super spreader, depending on the scenario. So it's disappointing to hear. And Chris, is it true too also that if somebody has traveled from out of state, that they can go and get tested, and if they test negative, then they can go back out into the public?
Yes, that's true, but they have to do that test within 72 hours of their return.
So that might be another thing to consider, is that your neighbors maybe are being a little bit better and they're getting out and getting tested before returning to public. And if not, we need to communicate to each other and keep our community informed so that we know what the guidelines are for safe travel in and out of the state.
Okay. Christian, at the CHA level, are you seeing a lot of cases coming about as a result of people traveling to and from the state?
So we're seeing travelers predominantly, especially in the Cambridge, but in our area, we're seeing a lot of family gatherings, people coming from family gatherings. I think mask fatigue, is just a real issue. I think people are, just exhausted from masks. So I think that's another thing. And I think just people getting together, I think they think that out in the open, they're safe. While they're safer than being indoors, I still think that there are still opportunities where people can be infected. So I think we're on an honor system. And there are places where people can go to get tested for free. So if finances are limited, there are places people can go to get tested for free, just to protect themselves, and especially their loved ones who are either around them or they may be interacting with.
Christian, can you give out where people can go on the internet to find out where those?
So the State Department of Public Health on their website does have a page where people can go to be tested for free. Obviously, we do have a testing tent in Somerville, in Assembly Row. We did that deliberately so that it's right there on it's on a public transit site, and you can be tested over there. And we're doing the anterior nares, so it's not going all the way up the nose and tickling the brain. It's a lot less invasive now. And the results are being turned around pretty quickly. Chris Webb's office has been very helpful to us in at least reaching out to Malden residents. So we feel very confident about that and working with that relationship.
All right, thank you. Ron?
Yeah, sure. Just want to remind the panel, we do have quite a few questions left to go, so we're going to try to move through these as quick as possible. We do have a caller on the line, but before we go to Lisa, we are just a quick question in regards to testing. Just for everyone's benefit at home, it would be mass.gov/stop the spread, mass.gov/stop the spread. And I personally have taken advantage of that website and found a convenient location right in our neighboring city of Everett. City of Revere has tests. Quick follow-up question again before we get to Lisa would be, now that we've approached the red zone, does this mean that we may eventually see these pop-up testing sites come to Malden, or are we still holding pat on that?
So Chris, do we need more consistency before we see that, or we might see something next week as a result of last night's designation?
We will probably need to go a little higher before we ask CHA to pop up a tent for us. I really want to see how the numbers clean up this week prior to the next report. On the next report, I may be calling Mr. Lanphere to see what we can do. We do also have Cataldo Ambulance who can do, if the teachers have an issue, we can deal with that. We have a mobile setup locally, and of course the state also has one. So we'll be having conversations between now and probably, I would say, Tuesday evening with our partners at DPH as to what would be available to us if our trend keeps going up.
Okay, anybody else want to add to that? Okay, Ron?
Okay, we are going to go to our caller. Lisa, go ahead. You are on the air with the panel.
Hi.
Hi.
I have an issue with the parks in Ward 7. I walk through Lincoln Park, Cross Street, and people are smoking. There could be a gang of 15 kids playing out in the field with no masks on, and I'm talking, 15 to 18-year-olds. I walk a little further down, you go to the skateboard park, you have the same issue. And then when I try to walk down Bryan Street, because they're doing a lot of work in all the streets, I can't even cross because none of the workers have masks on, and they do see me coming, whoever the city's hiring to do the streets, and it's really annoying. And I know Everett closed their parks. And is there a time that maybe you will close the parks? I mean, are people supposed to be smoking in the parks? I know we can't police everybody, but I mean, I know they say to stay away from people who are smoking. It's really difficult, when one is not working because of COVID, and to try to be outdoors and to stay away from all of this.
Yep, no, you're right on all fronts, Lisa. And if you can, when you see this happening live, please call that in either to our police department or you can email Chris Webb at cwebb@cityofmalden.org. That goes right to his phone. In the meantime, Lisa, we'll ask our officials to start honing in on Lincoln Commons and the skate
Well, I
park.
did a see-click fix when I took a picture of all the kids.
Okay.
But, they just say, send to constituent services, and then they close the case. They're really annoying me. I mean, they just don't tell you what they're doing for follow-up.
Lisa, who's doing that?
A see-click fix. So I took a picture immediately and sent it to see-click fix. Refer to constituent services, whatever that means. They say that for any issue that anybody reports, and then they close it. They never let you comment any further, which is really annoying also.
Right.
Because honestly, the whole ward is filthy. I mean, no matter where you walk, it's just a pigsty.
Yep. All right, Ron, were you going to say something?
Yeah, I just like to respond to the C-Click Fix thing. So just two things really quick. First is when it says it's assigned to constituent services, that's just an automatic thing that happens when the case comes under that particular user's purview. So if you put it under the category of other, it would get automatically assigned. One thing we do is anything that could be construed as a police matter, for instance, anything that requires immediate vigilance, eyes on, phone in, things like Mr. Mayor, like you just described. Because again, if we, the process of see, click, fix is normally quality of life issues that we evaluate and then usually respond to with the appropriate city department. So if you think about that, by the time we were able to evaluate and look at that, these kids are far gone out of the park. So when we close those tickets, we try to close them with the information on who you should be contacting for an immediate response. But if you have any other problems, if you don't find that, Lisa, to be the case, I'm going to invite you to call me directly here in our office, 781-397-7000. You can ask for me directly, and I'll follow up on whatever ticket that you're asking about. And I'll defer to you, Mr. Mayor, on the rest of the question.
Yeah, Lisa, let me take on the construction company that's doing the work down there. They should be masked up, so let me look into that.
They never
And
are.
Lisa, if you want to leave your contact information offline with the studio, we can follow up with you. But otherwise, I'm going to take the company on myself.
All righty. Thank you.
Okay. Thank you, Lisa, and thank you,
Thanks
Kevin,
very much.
earlier for
All right.
calling.
Thank you all. Thank you for trying. Thank you.
Okay.
And we can add to that, Lisa, that we did have the parks closed at the beginning of the pandemic. And then we found ourselves at an interesting intersection of wanting people to be outdoors for physical activity and to keep people walking. And so we had opened them up under the state guidance a month or two ago. But we will be reevaluating things like that when the numbers continue to climb. So we appreciate the reports. We're disappointed because we don't want to take those resources away from the community. But it's something that I'm glad we're aware of. And thank you for keeping us aware.
Okay, Mr. Cochran.
Sure. So this is a big one. We've been hearing a lot about masks, but the other kind of masks, the ones you wear around and get candy with. Is that still happening? Are we getting our Halloween here in the city of Malden? And what is the guidance from the state, from the local health department on that topic?
All right, Mr. Webb.
Well, just before this call, we had a Board of Health meeting, and Dr. Nickerson and Mr. Wilson came up with just a couple of things to add on to the state guidance, which right now the state and federal guidance is saying that Halloween is safe if done within the guidelines. And what we're asking of family groups is to travel together, but social distance whenever you can. When you come across another family group, wear a mask. Even under your Halloween mask, you need to have a protective face covering. No matter what your outfit covers or blocks, you still have to have that face covering. You should have hand sanitizer with you so that when you do make contact with people, you have a way to clean your hands so you're not touching your nose, face, or mouth with it. Then we'd ask the people giving out candy, if that's what they think is a responsible thing to do right now, they would try and meet the trick-or-treaters at the sidewalk so that they're not standing at their door and their respiration isn't entering the home. Then anybody handing out candy should wear gloves, a mask, and try unique ways to put as much distance between you and the trick-or-treater. And we're going to put up the CDC guidance and the DPH guidance on the website as we get a little closer to Halloween. So, because I'm sure they'll change a little bit, and to include the board's requirements, which are the ones I just explained.
All right, Kourtney, what do you think?
Happy Halloween. No, I think that this is a potentially safe way for us to approach a holiday that's beloved by many. And I think the other thing that we want to know is we want to do this as safe as possible. We've got some good guidelines in place. We're going to continue to monitor the numbers and monitor the most up-to-date guidelines from the state and the CDC to make sure that they are going to be implemented and keep our citizens safe. And then the last thing that Chris didn't mention was that we want to keep those interactions. So if you're at a house getting candy, keep that under 15 minutes. Try to minimize that amount of time that it has been shown to have the greatest risk of transmission of disease.
Kourtney, what was the vote of the board?
We two in favor. We had a quorum, right? So we had a good discussion about what the current regulations were across the state, the different towns, what they had proposed for standards to set, as well as what the CDC and state were recommending. And we put those together in order to come up with what we thought would work for Malden.
So on a 3-member board, was it 2-0 and someone was absent, or?
Right. Dr. Singh frequently has hospital
Is it
responsibilities, so we may
responsibilities?
have
Okay.
lost him tonight. Yeah.
All right,
Unfortunately.
very good. So, Chris, will you issue some sort of cohesive statement to the community tomorrow, you and the Board of Health?
We'll be putting the minutes together, and then I'll be working on almost like a flyer, so that we can post it on the website, kind of make it look like some of the emergency updates that we get.
Yeah.
And we'll title it as Halloween. So I'll be working on that tomorrow. Yes.
So, Chris, the bottom line is it's on, not that we really had any jurisdiction per se, but, it's not something that we're going to come down on. Is that correct?
That's true. And I just want to say one thing. I just want people to really give it a lot of thought, okay, before you do it. If for any time you're doing it and you don't feel like your children or a child is adequately protected, probably not. So don't do it. If you're giving out candy, be quick about it, and don't admire the kids with your door closed. If do the best thing you can to protect yourself and still make it a good time for the kids. But it's not without risk. And if you have a pre-existing condition or you're ill in some other way, maybe this year is the year you skip it and don't put yourself or your loved ones at risk.
So, Chris, not something you can, all things being equal, you wouldn't condone it, but if people do it, be safe about it, right?
Absolutely.
Yeah.
That's exactly what I mean.
This would be the year to take it off, but if you're insistent, be circumspect, right, when you do it.
Yeah, if anytime you think you're not being safe and you're out and it's not comfortable, you're probably right. And you should really just take the steps to protect yourself, go home and wait for another opportunity. There'll be others. This will go down again.
Okay. Christian, do you want to add anything?
No, I think, I applaud Malden for trying to keep some traditions alive, but I also support the fact that, common sense and just common measures that I think we've been talking about since March is the masks and social distancing. Those are two things I think we all can easily remember. And I'm actually quite impressed with some of the work that's already come out of this discussion based on Halloween, and I'd like to consider that in my own community.
All right, very good. Back to you, Ron.
Sure thing. So Diane on Facebook asks, there's a two-parter. First, will there be any changes being implemented to the restaurants based off of this new report? And if not, what would trigger that? And then part two, for a different question from Diane, is the warming center. Has there been any discussion about whether it's going to be open? And if not, there is a backup plan for our homeless population?
Okay, thank you, Diane. Let's first talk about the restaurants, which we talked about internally. And this designation doesn't change anything relative to the restaurants at this point, right? Is it more if we were to remain red over several weeks, then we would have to look at pull them back a little bit, Chris?
Yes, sir. That's exactly how it works. The new guidance is that we would be in the red category and rising for 3 weeks before we would be able to, under the current guidance, roll back a phase or a step. The first thing would be back to phase 3, step 1, and jump out of all this phase 2, phase 3 stuff and directly back to phase 1, which would really put a crunch on the restaurants and a few other businesses too. There'd be a lot of things affected, big and small. So we're hopeful that's not going to happen, but we are working on a plan to reclose everything if we have to. So we have a pretty good handle with the restaurants. The restaurants have been incredible in their response to this. And I can't say enough about that. I mean, we have had no issues with our restaurants. They're stepping up and asking questions and, hey, I think if I can do this, will it be safe? And sometimes it is, and sometimes it isn't. And they say, thank you, and move on. And it's inspiring, very inspiring.
Chris, let's get to the warming center. For those who are watching and don't know, thanks to the First Church of the Nazarene and several other houses of worship and volunteers, there's been a warming center for the past couple of years during the months of January, February, and March, where people have a place to go during the extreme cold. And so, Chris, has there been any talk just yet about what the future is of that?
Yes, I met with Pastor Whetstone 2 weeks ago, and we had a conversation about what it might look like. But he's planning on having it, but he will be working within the guidelines. And he's also taking steps to try and get some grant money to better define the spaces within the church hall, not only for COVID safety, but for individual safety and comfort. So we really don't know how that's going to go yet, but the building commissioner and I, we're out there, and the plan sounds good. Now they just have to put it on paper. All
right, stay tuned, Diane. Okay, thank you, and back to you, Ron.
Okay, we have Kevin is back with us for another time. So Kevin, go ahead. You are on the air with the panel.
Hi, panels. Hi again. I had meant to bring this up earlier, but I was wondering, we're considering it for my family, and I just wanted to share it with other Malden families. If you happen to live in a home that has a first floor window, there's enough of a drop that if you were to buy a small piece of PVC pipe or cardboard pipe, decorated with some nice Halloween glowing orange maybe lights, you're able to dispense the candy down that pipe right to the kid's bucket without even ever coming in contact with the child. You can wave at them from the window. My kids will be dressed up in costume, waving at the kids from the window, and they're able to shoot that candy right down that PVC, right into the kid's bucket. So, I mean, it's just a suggestion people can consider. It makes it contactless, and yet and still everybody can enjoy, Halloween.
All right, thank you, Kevin, once again. Let's see. Let's go to Miss Nickerson.
There's a
little bit broken up to me. Did you get it, Miss Nickerson, the question?
I did. Well, the comment, the suggestion. I think there's a lot of great ways for us to approach contactless or minimal contact distribution of candy. Some people have suggested setting like lollipops almost in their yards for kids to stop by and just pick up on their way by, or setting out we weren't as keen on this idea, but setting out a bowl of treats where people can take, because we didn't want people going into the same container. So a couple different ways to consider it. I think check the website, because we'll keep sort of those best practices or best ideas up there, as there is currently one listed right now. And then other ways to enjoy Halloween too. I think they have some contactless suggestions where you can have a costume party over Zoom and do costume contests that way as well. So yes, again, like Chris said, trust your gut. If you think you're not being safe when you're out trick-or-treating, or you're being excessively creative in how to distribute candy, maybe this year we sit it out.
Okay, and let's go over to Mr. Weldai. I know you have one of the best events in the city along with Councilor Murphy, and you've adapted, right? I believe you're doing something outside?
Well, so we're still in the process of figuring out. There's no one who's more disappointed about the condition we're in for Halloween than Councilor Murphy and right. Myself. This would have been, it's one of the events we look forward to every year. And we're going to adapt. So we had to cancel the 4th of July. We're going to try to adapt and do something, that we could bring directly to the community for Halloween. But I think the best thing possible, and it's already been said here, right, is just you control nobody's decisions but your own. So please be safe. We see clusters on places like Bainbridge Street and Trafton Park where folks really turn it into a big community-wide celebration. And we can't be upset when the numbers rise if we're the ones who are responsible for it. So, we miss one Halloween, we make it up for the next tons of Halloween. So, please be safe, make the best choice you can. And we're here to support you for that.
Yeah, that's right. Okay, very good. Back to you, Ron, in the studio.
Yeah, so we're actually running up against the end of the hour here. I think we're all done with our phone calls for the evening. And I think we've actually covered quite a lot of material here and a lot of those questions that were asked tonight. So we appreciate it. We say thank you to the panel. With that said, again, just a few minutes here. We'd like to let everybody, our panelists, close out for the evening.
All right, very good. Let's start with you, Mr. Weldai.
Sure. Thank you for having us. We know that having me, there's a lot of work that the school committee has been doing over the past couple months And it's been difficult. And I hope people know at home that if your feedback is important and it matters, there's a lot that we can't control, right? We're at the mercy of a pandemic. We're at the mercy of DESE. We are negotiating things on a regular basis. We managed to turn around a catastrophic Chromebook situation that was, essentially a vendor who lied to us and turned it into something positive for our community. And now everyone has technology that we can commit to for the future. So we know that there's a lot of challenges that have been behind us and still lie in front of us. And we're committed to working collaboratively with you, the community, to make sure that we get it right. And we won't always get it right, but we'll do the best we can. And we appreciate the extreme amount of grace and empathy and kindness and collaboration that we've seen so far. So thank you.
Very good. Thank you. Kourtney Nickerson.
I think just to echo everybody again tonight, the empathy, being kind to one another, having patience. We're all going through an unprecedented time, and all we can control is ourselves. So that is a great way of thinking about it. Please continue to wash your hands, wear your face mask, wash your face masks, or dispose of them if you have disposable ones. Think about sort of these little things that we can do day to day to protect ourselves, our communities, and our loved ones. And keep your chin up. We're doing a good job. We'll continue to get through this together. Thank you.
All right, next up, Chris Webb.
Thank you, Mr. Mayor. And you know how I love doing this TV show because we do get such great feedback. And I want to remind people that if they do want to get in touch with me, please call my office at 781-397-7049 or email me at cwebb@cityofmalden.org. We do get your issues through the both methods, and we address them as soon as we get them. We're not crazy busy with COVID complaints, but we are busy, of course, more people are home, so there are more complaints. But I would ask folks to really, focus on yourself, make sure you're keeping yourself safe, worry less about what someone else is doing. If you see someone coming at you on the sidewalk, move away, keep your mask on, don't confront anybody. It's not safe to do so. You just don't know who you're dealing with. And stay focused on your children, make sure they're doing what they need to do. I know it's difficult. I can only imagine. My children are older now, but I can imagine what it's all like. But make sure they're washing their hands, make sure they're wearing their mask. I see a lot of kids around town, especially the young ones. They do very well. It wasn't thought that would be the case, but it is. And, they're probably playing superhero in their mind, which is great. Let them do it, but support them in it. And watch out for your loved ones, keep your distance. You don't know whose jet stream you walk through, and it's all it takes. I appreciate everybody's efforts. I truly do. It's made my job easier. It's made the safety of this community much better. And, a lot of people are watching us. We're doing good things.
All right, very good. Thank you, Chris. And finally, Christian Lanphere.
Thank you, Mr. Mayor, and to our panelists. And thank you for making me be a part of your show. I think I've always enjoyed this. For so many of us we've been doing this work nonstop since this all began. And all we ask is that we get the public's help to continue to work with us by staying masked, social distancing, stay home if you don't feel well, and get tested if if you feel that you've been exposed or if you're symptomatic. We're here to support the community. So I want to make sure that, especially in this high anxiety times, that I think the best thing we can leave tonight is be kind to one another.
Very good. Okay, and on behalf of Ron Cochran, Maria Luis, and the staff of Malden Access Television, otherwise known as UMA, we want to thank you for tuning in and continuing to work with us. Again, this is a marathon, not a sprint. We wish that we were here talking to you about some of the other great things that are happening, such as some of our firefighters being promoted this morning, the build out of Malden Center Fine Wines across the street from where we are, Soul City Yoga, etc. but we have to focus on this. We all must continue to work together. So there's no question last night I was disappointed with the news, but not defeated. So again, let us continue to work together, and we cannot stress the importance to wear masks. It has to be done. And so this year, with Halloween being discussed at the Board of Health meeting and guidelines being issued, we would normally give out candy for Halloween, except for the Reese's peanut butter cups. I usually pull those aside. So this year, we're going to give masks to our residents and businesses with touchless drive-up. So everybody will be getting one of these. We'll announce when and where over the next several weeks that we'll distribute these throughout our community. They're washable. And, again, thank you for tuning in tonight, and let us continue to work together, and we'll be back soon to talk about where we are and where we're going. Thank you once again.